In the 1990s, seniors living in rural communities across the country faced increasing challenges in gaining access to much-needed healthcare services. Hospitals were closing, and only 10% of physicians chose to practice in these rural communities. Home health agencies also preferred to serve patients in more populated areas. Seeing this trend, Angie and Mark Edens bravely began a journey by launching their own home health company. They chose to work in these underserved communities precisely because they wanted to make a difference for these seniors. Under the AngMar umbrella are the companies Angels Above Us, Angels Care, Angel Care, Crown Health Services, Family Care, and Specialty Nurses. While each agency has the backing of AngMar's resources, the Edens wanted those qualified in the local communities to continue taking care of our patients. So our offices are often staffed with people who know the community, neighbors taking care of neighbors. The Edens believe in helping seniors live better and more independently as soon as possible. To that end, we admit patients and answer calls 24 hours a day, 7 days a week. And when new patients are admitted to our service, nurses and therapists visit them more often in the first 2 weeks than any of our competitors to get patients off to the best start and ensure great outcomes. We also see education as an important factor in each patient's recovery process and equip staff with tools for 10 disease management programs developed by our experienced team. In many communities, we may be the only provider of anodyne infrared therapy, an FDA-approved treatment that increases circulation and reduces pain. Some patients even report they don't need the pain medication, walkers or canes on which they once depended. For a more complete list of conditions anodyne therapy is used to treat, go to anodynetherapy.com. Whether the patient's home is a private residence, retirement community, or assisted living facility, our nursing staff makes it possible for homebound seniors to get quality health care so they can lead healthy, productive, independent lives.
Mark always referred to the home care nurse as the epitome of nursing. In the home, you get to spend a lot of time with the patient. A typical visit will last anywhere from 30 minutes to an hour and a half. So you're really going to make a difference and have an impact in the patient's life and treatment and recovery by that quality one-on-one time.
I like meeting the needs of the patients in their home. I like to go there and help them with everything that they do, all their needs, whether it's sometimes just environmental, and help them discover the things that they need there, and getting equipment that they need, or helping them with their medication, making sure that they have everything they need.
Our nurses, therapists, caseworkers, and aides often have the satisfaction of knowing they've touched their patients' lives in indelible ways. There's Ruth Travis and Jimmy Sochet, patients who better understand their diseases and how to cope with them. Anna Lee McFall and Betty Miner, who after recuperating from surgeries and practicing physical therapy exercises, are once again enjoying some of their favorite activities, like playing pool and swimming. It was to care for patients like these and others that Angie and Mark Edens first started AngMar Medical Holdings. Their dream to own home health agencies was realized in 2000 with the first purchase of a Nacogdoches agency named Crown Health Services. They also acquired another Texas company named Specialty Nurses in Mark's hometown of Wichita Falls. While the 6 agencies began as separate companies in different parts of the country, they became part of AngMar Medical Holdings and share a common mission. With the agencies and offices growing explosively, the corporate office experienced a similar surge. The original Arlington-based office expanded and moved 6 times to accommodate increasing staff and agency offices before 9 acres were purchased to build the Mansfield corporate headquarters. But AngMar's story is much larger than its growth. At its heart are the patients that the Eddens first dreamed of serving. Almost every day, we hear patients express their gratitude to our nursing and therapy staff who tirelessly teach them how to cope with chronic disease, recover from surgery, and relearn lost skills. Their lives are greatly enriched by the help they receive from our healthcare professionals. Often, these relationships grow beyond that of patient and caregiver. Our nurses may call even when a patient no longer needs our services, just to hear how someone is doing or offer a birthday greeting. It's not uncommon to have a patient's family stop by our offices just so they can say thanks to our staff. To us, that's a real measure of success.
You see results of your efforts and you get the satisfaction of seeing your patient do better.
When you see a patient get better, it's overwhelming. It's why I went into nursing. It's why many of us did, is to have that feeling of satisfaction. If I'm going to leave my home and my family for 40 or more hours a week, then I need to know that I'm making a difference in someone's life. In home health, I feel like I've done that.
AngMar Medical Holdings, professionals caring for people at home.